What is Obama going to do with everything other than the financial and economic issue? Now, he's announced his priorities are going to be the war on the economy at the top, then energy, then healthcare, then education. I think those are the sequences. But throughout the campaign, when he was asked, are there any things you would not spend money on because of the costs of the new programs, he said there are a lot of stuff, but the things I am going to spend on is everything.
You have Illinois at a very remarkable place with the elevation of Barack Obama as president, with Senator Durbin in leadership as majority whip. Rahm Emanuel certainly has done his time in the White House, but for all intents and purposes is considered a serious heavyweight and is now the chief of staff for Barack Obama. You have monumental shifts that are going to take place in Illinois.
Health engagement generally is on the rise, and I think this is an interesting backdrop to the sort of public affairs and grassroots warfare we're going to see over the next 6 to 8 months on this topic. So you can see 69% of Americans say I'm becoming more actively engaged in health issues, and that certainly plays into the current debate. 65% I'm becoming more actively engaged with health products and services, and 41% I'm becoming more actively engaged with companies and organizations. Our theory is that about 20% of the American population, I don't know what percentage of the actual electorate that is, but I would imagine it's slightly higher of the electorate, but of the American population, we call 1 in 5 health influentials. These are people who are not only going to listen to what main players in the public debate have to say on this, but are also going to be engaged, people who are likely to write their congressperson. We ran a number of messengers by individuals to find out which were the most credible and which were more credible than others. And as you can see, topping the list is not surprising: doctor, healthcare professional, pharmacist, and on down to, and I think what's interesting here is my employer at only 50%.
Those are the really, really tricky questions. If Congress bites the bullet and starts redistributing some of those spending, then the ultimate overall cost of healthcare reform goes down.
On behalf of Gina and Peter, as your hosts here, and for the panel, thank you all very much for 2 of you coming all the way from DC, and Val for you getting ready in the midst of everything else you've got going on. Thank you all for coming. We hope that this was a valuable discussion, a service to you, and we look forward to you staying in touch with us.
I have to go back and kind of digest this again and look at it, because there was just so much information and I was scribbling notes just as quick as I could to kind of take it in, figure out how we can digest this, and then how do we potentially need to change our, I don't want to say our direction, but maybe change up how some of the tactics that we're doing in order to be more effective at what we do.
And I guess the thing that jumped out a little bit is, while we're all familiar with social networking, just the fact that now social networking seems to be now even playing into the generating grassroots in the political arena.
The takeaway that I had from working for a physician association is just the importance and the centralness of surgeons and physicians and as a communication device for patients and for voters and constituencies.
Public affairs globally for Edelman has just taken a very accelerated pace, because we have a new Washington, a new Congress, new regulation, new legislation. So it doesn't have to be healthcare. It can be environmental issues. It can be, just general business practices. Whatever our clients need, we're in a position to be able to kind of help them navigate through that and build sound programs that they can then take to Washington and use throughout the rest of their work doing business.
I think this is a very useful exercise. I mean, one, it was fun. I think the audience enjoyed getting a little bit of the flavor of what's going on in Washington, but it also has a practical side. I understand afterwards that our Washington office, in conjunction with the Chicago office, is in the middle of an RFP with a couple people who are in the audience, who are asking questions, we're interested, we chatted with before and afterwards.